Bonjour tout le monde. Hello everyone. Before we get into things, I want to address recent news coming out of the UK. My thoughts are with Prime Minister Johnson and his family during this time. I've worked with Boris for some time now, and I know how committed he is to serving the people of the UK. He's a fighter, and he will be fighting now to regain his health and get back to the job he loves. Sophie and I and all Canadians are wishing him a speedy recovery. To our British friends, Canadians, stand with you. We will get through this together. Over the past few weeks, almost 5,000 Canadian companies have stepped forward to help fight COVID-19. On behalf of all Canadians, thank you for stepping up. As countries around the world grapple with this pandemic, the demand for critical supplies like test kits, ventilators, and personal protective equipment is going up. To keep our frontline workers safe and care for Canadians with COVID-19, we need a sustainable, stable supply of these products, and that means making them at home. With our plan to mobilize industry, we're helping companies retool, repurpose, and innovate to fight COVID-19. We've already signed letters of intent with a number of partners to produce the things we need, and today we have more good news to share. We're working with Thornhill Medical, CAE, Ventilators for Canadians, and a group led by Starfish Medical to produce up to 30,000 made-in-Canada ventilators. These purchases will help increase our capacity to make sure these life-saving machines are made right here at home. We're also working with Nobel Prize-winning researcher Dr. Art McDonald, who is leading a team of scientists to develop ventilators that are easy to make. And to produce medical gowns and establish new supply chains right here in Canada, we're teaming up with over 20 companies, including Arc'teryx, Canada Goose, and Stanfields. One thing that is particularly inspiring to see is just how many companies are not just producing these goods, but innovating. For example, Autoliv is looking to make medical gowns out of material they'd normally use to produce airbags. Our government is working around the clock to ensure that our frontline workers have everything they need to save lives and stay safe. While we're working to secure critical equipment from Canadian sources, we're also in touch with other suppliers around the world who want to sell to Canada. We're expecting 500,000 masks from 3M tomorrow, and we're working as fast as we can to get them to our frontline workers. From the outset, our priority has been the health and safety of all Canadians. So whether you're making medical gowns, delivering ventilators, or treating a patient with COVID-19, we have your back. We're going to be there for you. We also have a 3-point economic plan. It supports business owners, including through new loans, while safeguarding jobs with the wage subsidy and helping those who no longer have a paycheck with the CERB. Yesterday evening, our government proactively shared our proposed legislation on wage subsidy with opposition parties. I know House leaders will be speaking throughout the day to reach an agreement for the House of Commons to quickly pass this legislation, which will give much-needed financial support to Canadian workers while helping employers to keep their staff on the payroll. A lot of work has been done since we announced our plan to subsidize wages. We continue to rely on your input and feedback as we refine it, and we'll have more details to share very soon. Yesterday was also the first day people could apply to receive the CERB. On that note, I want to recognize the tremendous work done by the public service, who processed hundreds of thousands of claims. They're working around the clock to get Canadians the help they need as quickly as possible. And I also want to remind everyone that if you were born in April, May, or June, today's the day you can apply. Finally, as some of you will know, today marks World Health Day and National Caregiver Day. This year, I'm especially grateful for our healthcare professionals and caregivers who are working day and night to keep us safe and to care for our most vulnerable. As Canada confronts this pandemic, many have pointed to our healthcare system as a major asset. Ours is a country where health is a right rather than a privilege, and that's something of which we can all be proud. But our healthcare system is only as strong as the people it employs. Whether you're a doctor or a nurse, someone who keeps our hospital clean, or a home care worker, thank you for taking such good care of us. Thank you for everything you've done over the years to help so many of us start a family, overcome an illness, and enjoy longer, healthier lives. We do not need a pandemic or a special day to recognize your essential contributions to this country, but I hope all Canadians will join me in expressing our deepest gratitude. I hope Canadians honk a little out louder when your shift ends today and add another rainbow to their window.